Please feel free to post questions or make comments during the event using the chat function, which we'll be monitoring throughout the event, and we'll seek to answer your chat questions during the scheduled Q&A session. Today, we will have speakers both live and pre-recorded, and we are really pleased and indeed honoured to have received contributions from 2 Welsh Parliament ministers. The first of these contributions to get us started being a pre-recorded video from our First Minister, the Right Honourable Mark Drakeford.
To help celebrate Diverse Cymru's Ethnic Cultural Competence scheme and to acknowledge the progress those who have taken part in it have made. Today, we also recognise World Mental Health Day and continue to celebrate Black History 365. We as a government are proud to fund the Cultural Competence Certification Scheme because we recognise the importance of developing good practice to ensure the services or organisations provide are fair and are equitable. As Welsh Government's BAME COVID-19 Advisory Group of the Socioeconomic Group clearly highlighted, Black, Asian and minority ethnic people in the United Kingdom face many inequalities. It is these disparities that lead people to have poorer life chances in all areas of life, and we believe that organisations have a key part to play in overcoming this. Our Together for Mental Health delivery plan also recognises the inequalities and social determinants of health for our minority ethnic communities. The plan includes a broader range of actions. It retains the focus on implementation, and it also incorporates ongoing work from previous plans. And this includes the Diverse Cymru Accreditation scheme. The scheme is part of our determination in Wales to make a new history, acting on lived experiences, however hard they are to hear, so that jointly we co-design the shape of an authentically anti-racist Wales, a Wales where all our different histories inform what we do and indeed what not to do in the future. It's the richness and strengths of the contributions that BAME people make and their communities to help Wales make that new history every single day. We celebrate Black History 365 every day of the year, but as we move through Black History Month, we also reflect on this year's theme, celebrating local heroes and sheroes, and to thank those who work so tirelessly within our communities. Diverse Cymru's Suzanne Duval and her colleagues who have developed and delivered the Ethnic Cultural Competence Scheme. Betty Campbell, whose legacy as a trailblazer and a change maker was globally recognised with the unveiling of her statue in our capital city recently. Professor Charlotte Williams's work on Cyfnefin that led to Wales being the first country to make Black history mandatory on the school curriculum. And Gaynor Legal's work on monuments and engaging senior leaders like Professor Ogbonna, who have helped to steer our work on anti-racism that shows we are in the midst of making a different history. Congratulations also to all those who will be receiving their certificates today, and also those who have embraced the Ethnic Cultural Competence Scheme. You are helping us to deliver on our promise of a fairer and more equal future as we create an anti-racist Wales by 2030.
Well, there was a big thank you to the First Minister for his contribution, which in many ways acknowledges the importance and need for a scheme of this nature at this current time in helping individuals and organisations on the journey to providing fair and equitable services. And I'd just like to say as well, what an honour it was for him to mention myself and the team for our work on the scheme in the same sentence as Betty and those other great sheroes that he spoke about. So thank you so much for that. It now also gives me great pleasure to introduce live our Minister for Social Justice, Jane Hutt, MS.
Bore da, and good morning to you all, and so great that I can join you this morning, and also just follow on from the First Minister and say a few words of support and welcome as well today, because this is a very important event, a very important webinar, vital to the way we move forward, as the First Minister said, to move forward with our Race Equality Action Plan to make Wales an anti-racist nation. So I just want to say again that we're celebrating today Diverse Cymru's unique Black, Asian and Minority Ethnic Cultural Competence Education Scheme. And, you know, to know that Suzanne, and I know I'm able to stay with you for a short while to hear some of the speakers, Charles, and all of you who've made this happen, it's going to be critically important in implementing our Race Equality Action Plan. And that's what people want. They want implementation. They want things to change. But I'd also like to congratulate those who are receiving their certificates today, Caswell Clinic and Public Health Wales, because you are going to be the pioneers and champions out there, and you need to share and engage with all your colleagues. You've got such an important role to play. It can't be just government saying do this, it's got to be you in your practice and the way you deliver services and how you enable all your teams to deliver them with this cultural competence. So you have such an important role to play, and I know we'll hear more about that. But I do want to echo all the points that our First Minister has made this morning, and paying tribute to all of those Black, Asian and minority ethnic figures, past and present, whose struggles and sacrifices have helped shape our modern Wales. And we have had an extraordinary couple of weeks, haven't we? Those of us who were there at the unveiling of the Betty Campbell, I think it's a monument now. I think we're seeing that this is much more, well, a statue is a statue. What do we make of it? And Gaynor Lagal's work is so important in terms of taking that forward with our understanding of our history and also guidance for how we move forward. But that statue of Betty Campbell is a monument which will have such an important impact and power, I think, for us and for future generations, to show the learning, the listening, the impact, the influence and the struggle and the courage that Betty has had. And so many here today are still having that kind of experience and influence. But also, as Marcus said, last Friday, launched of Black History, no longer just a month, 365, as you said, Suzanne, the sheroes and heroes who help us today create the anti-racist Wales we all want. So I think one of the things that I want to say is that the importance of the Race Equality Action Plan is at a critical point in terms of consultation. So just a few words about that from me as you start the webinar. We've supported the certification scheme as a Welsh Government, being recognised here today, because, as I've said, it is going to be so important in terms of implementation, driving the plan forward. And I think I'd like to thank Diverse Cymru, particularly for the key voice, key role you played. And Suzanne, how many meetings we've had on Zoom over the past year or so, and many colleagues who are here today. Endless. This been a discourse. It's been about how can we develop this Race Equality Action Plan in a different way, engaging and listening and learning, and contesting and scrutinising and challenging those of us who've got any power or responsibility to try and take this forward. So thank you again today. You know, and you have played a key role in so many ways in what's been we've been doing over the past, not just the past 20 months, but for the life of Diverse Cymru. And I remember when it all started as well. I want to thank everyone actually here today who've already responded to the consultation. It does, the plan does recognise, I believe, our ambition, as the First Minister said, to create an anti-racist Wales by 2030. You know, shouldn't we be able to say we are an anti-racist Wales now? We aspire to be an anti-racist Wales. We're saying we must be by 2030. We aspire to be a nation of sanctuary. And actually, if you say that's what you want to be, you start living and breathing it. And I think that came over very strongly in the way we've responded. So with the refugees who've been coming so recently to us in the last few days and weeks from Afghanistan. So just a few words about where we are with the consultation. We've had a lot of responses, 330 individuals and organisations submitting their views. And I think what's so important is it's in a variety of ways, because we didn't just want the formal, well-funded or the organisations, statutory and third sector to respond with written responses. We've had videos, we've had films, we've had minutes of meetings, and we've had those local groups who we funded to do the work to actually get the views back, to share the plans, aspirations with people. We've had our community mentors in the Welsh Government who've had a huge impact on officials and the ways of working, and ministers. Ministers have had anti-racist training just before the election. And of course, we've got a steering group which is co-chaired, as First Minister said, by the Permanent Secretary and Professor Emmanuel Ogbono. It's a very different way of doing things, and we had to do it differently because we knew that, you know, that was the challenge to us. So we're underway with reviewing the responses, considering what changes need to be made, and also just looking at, well, you know, step by step, how can we then pull this all together into the outcomes for the plan, the amendments, changes, additions. But of course, some things are already happening, and they're happening because of the work of the plan. So we've already agreed we're going to have a race disparity unit in the Welsh Government. That was one of the first things that was recommended last year as a result of the disproportionate impact of COVID-19 on Black, Asian and minority ethnic people and professionals and communities. So the race disparity unit, embedding that into the Welsh Government is underway. Of course, also the work undertaken by Professor Charlotte Williams, statutory now Black history in the curriculum. We've been celebrating that over the last week because, that was one of the things that Jeremy Miles, our education minister, he was applauding and welcoming last Friday, a week ago today, but also moving on with the work led by Gaynor Legal. So on the audit of statues and monuments and street names. So I think it's not going to be a waiting, oh, where is it? It's actually, we're already implementing it, but you are implementing it as well. I think that's what's the most important message from me and to all of those who received the certificates and who have joined today. The ethnic cultural education scheme, competence scheme, is going to help implement the race equality action plan. So we will obviously let you know how things are going and emerging. We have a race equality forum. We also have soon to respond to the results, which of course Diverse Cymru has played a part in, on the strengthening equality and advancing human rights research that's been carried out by Swansea and Bangor universities. And also, can I draw attention to the fact that on the 19th, I think, of October, just in 10 days' time, we're going to have a Senate debate on tackling racism. We've done that every year. We've managed to get cross-party support for those debates, which is very important in terms of the message that comes out from your Welsh Parliament, from your Senate here today. And it will be I know there will be a lot in that debate about the Race Equality Action Plan. So thank you very much for inviting me. I'm going to be able to stay for the next 10 minutes before I go to my constituency events on a Friday. But we want to just say thank you for the spirit in the way in which Diverse Cymru has worked for so many years, and the influence and impact you've had on people's lives. And this cultural competence scheme is a true reflection of that. Diolch yn fawr.
Thank you very much. Wow. Well, thank you, Minister. I'm grateful not only for your attendance, but also for those words of encouragement and commitment as set out in the Race Equality Action Plan in tackling the many evident health inequalities experienced by many of our ethnic minority communities, and also for the aspiration for Wales to become an anti-racist country and a country of sanctuary, which I hope and believe that we are on the way for this to be fully realised. Thank you so much. Can I now ask Dr. Charles Willey, and I'd like to say my best friend, my supervisor, my mentor, and the drive, the absolute drive behind the certification scheme. If it wasn't for his 24/7 work ethic on this scheme, I know, and I do know, we would never have been as far and as wide with this. So thank you so much, Charles. And I'll ask him now to give more information about the scheme's history and ongoing development. Thank you.
Thank you. And I didn't pay her for those words, but thank you anyway, Suzanne. Thank you very much. And really, really pleased by the contributions from both the First Minister and Jane, who known for a long time, and I know that in terms of their passion and commitment. So thank you for that. Name's Charles Willey, the founder and former Chief Executive of Diverse Cymru. And since my retirement in 2016, as Suzanne has indicated, I've been heavily involved in the design and development of the certification scheme as the scheme's project advisor. From my advisor role, I just want to provide a very brief overview of the need, history, progression, and the ongoing development of the scheme. And in very simple terms, with regard to the need, stems from the fact, as has already been mentioned by the First Minister and Jane, that Black, Asian and minority ethnic communities, including here in Wales, continue to experience inequalities and disparities in all areas of public life: criminal justice, employment, health, and indeed mental health. And in mental health, for example, if you're Black, you're 4 times more likely to be detained under the Mental Health Act, and 49% more likely to end up in intensive care or secure services, and 40% more likely to be turned away when seeking help from mental health services. Truly shocking statistics, but they're facts. And although these inequalities have been of concern for decades, as is clear from all the statistical and evidential information available, a still significant equity gap remains for Black, Asian and minority ethnic individuals, which the research also suggests in some areas things are actually getting worse. Whilst not the only factors, 2 key issues extensive research makes reference to with regard to these inequalities and disparities: the impact of unconscious bias and that of lack of cultural competency in service provision. And taking note of that, of these 2 issues, in 2016, Zan Deval wrote and published a cultural competency toolkit for mental health providers and practitioners, the first of its kind in Wales, which the toolkit had lots of positive feedback. But there was a fear, as there always is, that this document, like many others in the past, would be left in a drawer somewhere on top of the cupboard. And as a good document as it may be, that there would be no real action or sustainable change made to improve cultural competency and mitigate against unconscious bias. So to ensure that this did not happen, myself, Suzanne, and Anthony Wilkes, who will be speaking shortly, of the United Kingdom Investors in Equality and Diversity Accreditation Organisation, set about finding a mechanism that would seek to ensure ongoing action and behavioural change. And following 2 years, consultation, engagement exercises, this mechanism is what you see today as a cultural competence certification scheme. In essence, workplace developmental tool, which importantly is based on practical, achievable actions being taken by a workplace in order to improve cultural competency and consequently incrementally improve the disparities faced by Black, Asian and minority ethnic individuals. And it's important, I made the term or use the term workplaces, because what I'm very clear about, or we're very clear about, the difficulty in changing whole organizations, hence working with workplace areas within large organizations such as a health bank has been a unique feature of what the scheme is about. The scheme was actually launched on the 11th of October 2018 by the then Cabinet Secretary for Health and Social Services, Vaughan Gething, and I'm pleased to say is also endorsed by the Royal College of Psychiatrists in Wales, and as heard before, is financially supported by Welsh Government as part of their Section 64 third sector mental health grants. The scheme proactively addresses any cultural or unconscious bias issues, raising awareness of these issues in the 3 awareness sessions provided. I didn't mean the number 3, but the view in terms of there are no costs to actually providing this awareness sessions. Alongside the completion of a self-assessment workbook in order to make a practical, positive, ongoing difference in the workplace environment and the services it provides. So we're not just talking about the services provided, but also in terms of the staff within the workplaces as well, looking at how they would interact and react with one another. It uses an evidence-based approach that focuses on supporting participants to effectively meet and respond to the needs of a culturally diverse workforce and the Black, Asian and minority ethnic users of its services in a resource-efficient and cost-effective manner, providing participants with relevant techniques and interventions that are tailored, and that's important, to their workplace to incrementally help participants to work towards providing an effective, practical, culturally appropriate work environment and the delivery of culturally competent services. The level of progress made by scheme participants is acknowledged by a certification process, hence certification scheme, through assessment by Diverse Cymru and the validation by the United Kingdom Investors in Equality and Diversity. Importantly, participants receive ongoing proactive support until certification is achieved. And whilst for workplaces, the recognition of progress is important, the main purpose and intention of the scheme remains that of continually suggesting and moving things forward in terms of ongoing improvement of cultural competence practice in the workplace. Whilst the certification scheme is tailored to individual workplaces, it is also very much about sharing good practice, ideas, and good things in terms of, and the original name of the scheme was actually the Workplace Good Practice Certification Scheme. And that's the fundamental part of that, is in terms of being able to share good practice as far as organizations and outside of organizations are concerned. As we shall hear from the two participants receiving their certificates today, as to how they've utilized the scheme to further their cultural competence and share good practice. And I hope that their experience will give all of us ideas for our own workplaces, as learning about each other's successful actions will help us to achieve cultural competence more quickly and to ensure that our services meet the needs of our Black, Asian and minority ethnic people in Wales and indeed beyond. Since its launch in 2018, despite almost standstill caused by the pandemic, the scheme has actually gone from strength to strength. And for example, it has now over 75 areas in which includes all over Wales, where participants from all 7 health boards, community mental health teams, forensic wards, reception areas, public health trusts, all the leading third sector mental health organisations, as well as learning disability and substance misuse organisations. And more recently, since the scheme has been expanded to cover other public service areas, a number of local authorities are in the process of registering. Interest in the scheme has also come from other parts of the UK. For example, universities in England and Scotland and in Ireland, working with the Mental Health Reform Organisation, produced the Ethnic Minority Communities and Mental Health Cultural Competency Toolkit, which will be launched on the 28th of October in Ireland. Additionally, the scheme has been included as part, an integral part of the Public Health Wales Quality Improvement Programme for health boards, and as mentioned by the First Minister, has been included in the latest Welsh Government Together for Mental Health delivery plan, and also included as an immediate recommendation in the First Minister's COVID-19 Black, Asian and Minority Ethnic Subgroup Action Plan. So just finally, from a personal perspective, having worked in the equality and diversity arena for something like the past 30 years, I'm very much of the view that the certification scheme, whilst not a panacea, is a very positive step forward in the right direction in seeking accountability and action, as Jane mentioned, to deal with the acknowledged disparities and inequalities faced by minority communities, and has the potential to make a real difference in the lives of BAME communities in Wales. And as an initiative conceived and designed in Wales, is something that Wales and Welsh Government, I think, should be rightly proud of. I'm very pleased that both Jane and the First Minister have made reference to this. Thank you. You're on mute. You're on mute, Suze.
Yeah, I know, I'm just taking it off and saying something has to happen. It can't all go smooth, you see. I just want to say thank you anyway, Charles, for that overview, and indeed for the fantastic work that you've done in taking forward this initiative. Can I now introduce Anthony Wilkes, founder and chief executive of United Kingdom Investor in Equality and Diversity, who has been with us as a partner from the start of this journey.
Borida, good morning. I'm really pleased to be at this special event, and I'm not going to go into the details in terms of how it all came around. Charles has just taken us through that, and but as I say, I'm really pleased to have been part of this journey. And in preparing for the session, I went back and I kind of looked at the work that we'd done before, and I don't know if Charles and Suzanne can remember. We'll probably remember by the increased grey hair, Charles. But I think originally we had a relationship for around 10 years, and it was about 4 or 5 years ago that you asked me to come on the journey with you, and I was really pleased to be asked to come on that journey. The question that always struck me is why there wasn't one before, given the history, given what we know, both from from the criminal justice and mental health as to why it had taken so long to have got to this point. But Charles talked about the scheme, and the scheme is truly unique, and it's unique in many ways. And when I started out on the journey with Charles and Suzanne, I probably had a vision of it operating in a slightly different way. But what was really consistent was Charles and Suzanne's perspective that this scheme is really about transformational change. It is really about behavior and organizational change, and really that the service users were front and center of the experience that was going to deliver. And throughout the various iterations of this process, they held steadfast to that vision. And as I say, this was reflecting back 5 years ago when we were kind of thinking about, you know, what was needed and what could deliver that change. And as I say, this process went through quite a number of iterations. And I think what we've got now is the best of its kind, certainly in terms of the UK. So both Suzanne and Charles deserve a lot of credit for that, for the hard work that they've invested in this, and those that have supported it on the way. So the scheme is unique in terms of it's developmental, so that, you know, organisations can come on wherever is appropriate and work their way through. It's focused in terms of the content is fit for purpose in terms of the culture change and the transformational change. And as Charles mentioned earlier, the support, it's not a scheme whereby you get on and you get off at the end and there's no support. There's support all the way through the journey, because organisations will be starting from different places. And so that's really quite an essential component of it. And as an organisation, UKIED as an organisation, we're really pleased and proud to have been able to contribute to what I believe is the best scheme of its kind. I'd like to extend our congratulations also to Caswell Clinic and Public Health Wales, and look forward to the scheme having many more participants and many more graduates succeeding through, because that will lead to real significant transformational change. And as I say, I just want to conclude by thanking both Charles and Suzanne for their fantastic work, truly memorial work in this regard. So thank you.
Oh, thank you very much to you as well, Anthony. And again, can I thank you for your guidance and advice in the inception and continuing development of the scheme. We're also pleased and proud to be a partner with you in this work.
Thank you.
I'd like to introduce another individual now who's also been with us from the start of the journey, and that is Oliver John, the manager of the Royal College of Psychiatrists in Wales. Over to you, Oliver.
Thanks, Suze. So as Suze mentioned, I'm Ollie John. I manage the college in Wales. I'm really pleased to be able to be here this morning. Listening to the video from the First Minister, which was excellent, I'd probably add Professor Al-Krahuja, who led on the rollout of video consultation in response to the pandemic, to that list of names. You know, we'd all have names of personal friends and people who inspire us, wouldn't we? But it's fantastic and important. We better recognise the contributions of people in society, and it's great that we're starting to do that. We're not good enough in Wales about talking about things in mental health, which sometimes can be uncomfortable. The challenges faced by people from Black, Asian and ethnic minority backgrounds are historic. Charles has highlighted this so articulately this morning. It's what many of us know about problems with accessing services, and of course the cultural competence required to make those services as effective as they should be. So I've been so delighted to work so closely with Susan, Charles. You know, it's great that we've become good friends throughout this process, you know, and of course the wider Diverse Cymru team as well. And you know, welcome to Chris, who's stepping in, who's speaking in a minute to such a great organisation. I've actually known Suze for many years. Prior to working with the college, we worked together on projects with social housing and the whole City of Sanctuary agenda as well. So it was great to work again in a slightly different capacity. So our role as a college was endorsing this work back in 2018. We've helped shape some of it, but our role has largely been in advocacy, and it's great to see an example of work which was commissioned and developed in the voluntary sector being supported and having such an impact in secondary care services. I feel, I hope others do as well, but this is a really great example of how organisations in mental health can and should work together. I think it's really important to give credit as well to Welsh Government, not just in the more recent developments on this agenda. I recall meeting with Welsh Government, with Zoe, Susan, Charles, to say that the funding for this work under Together Mental Health wasn't enough at the time to make the difference we were starting to see. And they really listened. And I think that's really, really helped where we are today. So I really applaud the work that Diverse Cymru have done, the impact they're making, and we're committed as a college to continue to work in partnership and in support of that work. It's always fantastic to receive the regular updates from Charles on the progress that teams across Wales have and are making. What's always great to hear is how teams are actually coming up with innovations and co-produce solutions to make sure services are accessible and as culturally competent as possible. As Anthony said, it's about that ongoing support, and I think that's what also makes this initiative really, really unique. Congratulations to Public Health Wales, and finally, selfishly, it's particularly great to see Caswell Clinic, who were also very early adopters of this programme, so engaged in this work. The work that they do is fantastic in an area of mental health services that often gets overlooked, but is staffed by and supported by people who are so committed and passionate about improving patient care. So I'll end there, because I know we're keen to hear from the services who've been from this programme themselves, but lastly, thanks again for allowing me to contribute this morning.
Oh, well, thank you very much, Oliver, for your contributions and the support that you've always shown us and the Royal College that have provided throughout this journey, and indeed the endorsement of the scheme by the Royal College. We're really pleased and proud to have you with us as a partner. And now can I introduce, and he's absolutely brand new, Chris Dennan, who's our recently appointed Chief Executive Officer of Diverse Cymru, to say a few words.
Hello everyone, and welcome. It is wonderful to see so many of you here today to celebrate with us at our inaugural certification presentation event. And first, I'd just like to say congratulations to the Caswell Clinic and to Public Health Wales for their amazing support and for undertaking this truly wonderful scheme. You know, I may be new to Diverse Cymru, but I am very proud that our cultural competency toolkit, you know, which Suzanne produced back in 2016, has been the springboard to this unique Black, Asian, minority, ethnic, cultural competency scheme. The scheme has been used by organisations and workplace as a means of making sure that their services are fair, are inclusive, and are equitable. And it's heartening to see that so many recognise that there is a necessity in providing culturally competent services. And it's really exciting to see how each scheme participant is doing this in their own unique and individual way. And I think that's the beauty of this scheme. It's tailored to the individual workplaces. So both big and small actions can make a significant and positive differences to how Black, Asian, and minority ethnic people experience their services. Initially, the certification scheme was designed for mental health services. However, it became clear that this would be a valuable resource to any and all private, public, and third sector organisations seeking to overcome their acknowledged inequalities and disparities experienced by Black and Asian minority ethnic people who use or may be excluded from using their services. Therefore, we were delighted when Welsh Government, which funds the initiative, gave us that additional funding for the scheme so we could expand it beyond its original remit. And today, the scheme's participants include all health boards in Wales, local authorities, universities and charities, with workplaces operating in the fields including learning disabilities, dementia, substance misuse, education and mental health. We hope those of you here today who aren't already participants of the scheme will consider joining and further broaden the range of organisations and workplaces that are working towards achieving cultural competency. It's wonderful the certification scheme is endorsed by the Royal College of Psychiatrists, and it's a huge encouragement this has been recognised in such a way. The Royal College, who is co-hosting today's event, and I would really like to thank Oliver John, Liz Williams and Antonia Fabian from the organisation who've planned today's event with us. And it's also very important to Diverse Cymru that the United Kingdom investor in equality and diversity provides the quality assurance and validation that underpins the certification scheme. And I'd like to thank Anthony Wilkes from the UKIED, who, as you've already heard, is a co-partner and has been instrumental in the design of this scheme. I'd like to thank all the participants so far of the Cultural Competency Certification Scheme for their support and working with us to make a difference to the lives of Black, Asian and minority ethnic people in Wales. And finally, I'd like to thank Sheila Mayer, Suzanne Deval and Charles Willey for their leadership, for their commitment, and we've already heard today their passion to ensuring this scheme's success. So thank you everyone for taking your time to celebrate with us, and I'm looking forward to the rest of the morning. Thank you very much.
Oh, thank you, Chris, and thank you. We look forward to continuing this work with you now that you're on board. That's great. Okay, now to the most important part of the event, the first certification awards made to the scheme participants. For each award, there will be a short video showing the presentation of their certificates to the workplace, followed by the lead individual of the workplace saying a few words about their cultural competence progress. So first we have the Caswell Clinic presentation video. No sound.
For the progress we've made towards cultural competency in the workplace. Thank you very much, Suzanne. I just wanted to say it's been one of the easiest projects for us to implement. Charles's help. We are proud of the progress that we've made and will continue to do so. Thank you. Oh, thank you. Thank you very much.
How wonderful it was to present Joe and Gareth, the Divisional Swansea Bay Director, with their certificates where under Joe Sullivan's lead, real cultural competency progress has been made at Caswell. Joe, it's over to you.
Hopefully you'll be able to hear me a bit better this time.
Yeah, there was no
okay.
sound.
Well, I mean, just to start with, I want to say how truly delighted we are to receive the certificate on behalf of, I am on behalf of Caswell Clinic. And we, as been mentioned, we were on board quite early on as a pilot site for mental health and learning disabilities in Swansea Bay. And I'm pleased to say that since we've started, there is now a designated lead for the rest of the learning disabilities and mental health services. So that's really good news. As I've said, it's been a real privilege to lead our multidisciplinary diversity group, and with the support of Charles and Suzanne, I think we're proud of the progress we've made. When we first started the conversations with Charles and Suzanne about cultural competency, we believed that we'd had a small number of patient groups, and that we thought we tried really hard to meet their individual needs, but it became obvious fairly quickly that there was significant room for improvement. So one of the things I really like about the scheme is the fact that it includes both patients and staff's experience of the service. And so we have included those two trends in our ongoing action plans. We've had a couple of yearly action plans, and some of the things that we have managed to achieve in that have included. So first of all, we had conversations with Charles and Suzanne about making it a welcoming place. So we put together a cultural competency or cultural awareness couple of slides and added those to our TV screen. And then we launched a poster competition because I thought that was a way of getting the whole service involved, but also it was a bit of fun. And we ended up with 2 winners because we couldn't choose between the 2. So we've got a poster in our reception area and also one in our family visiting suite. We acquired, with Suzanne's help, a variety of leaflets. So we've got on various topics, including things like medication and mental health sections, but also we had some leaflets, for example, on coping with COVID. So those have been shared across the wards. We furnished our library with relevant literature because, again, we recognised that that was a gap. And we revamped our multi-faith room, and it's looking better, but I think there's still room for improvement there. Charles and Suzanne offered training sessions for us on cultural awareness and, I think, as importantly, unconscious bias. And that's been greatly received by the staff that have been through so far. And we are hoping for further rollout of the training. We had planned to have a patient forum, but because of COVID, we weren't able to do that. So we instead used some questionnaires that we sent to our patients to ask about their experiences, but also their cultural needs, to make sure that there wasn't anything that we were missing. One of the other important things that we did was we looked at the demographics of our patient group. And I think this is in keeping with some of the conversations earlier about mental health and the criminal justice system in terms of the disproportionate number of patients who access services from BAME backgrounds. And as I'd said in the beginning, we thought originally that we had a small number of patients that accessed our service from Black, Asian, minority ethnic backgrounds, but in fact it ended up being 20% of our patients over the previous 5 years. So when you compare that to 6% of the Welsh population, or just over, and 20% of our patients, is really significant. And similarly, the figures in prisons, looking at, for England and Wales, the 27% of people in prisons, again, hugely overrepresented, which of course makes sense as to why we have more in our secure service, but really is something that we'd love to do to tackle further. But I think as an isolated unit, we would definitely need some broader support with that. I did take this presentation to one of our sister units in England because we had shared clinical days and their experience wasn't any different. So I guess we know this is a national problem, but something that would be great to tackle longer term. And then we also looked at the staffing profile, and no surprises there really, in that we had a very small number of staff from Black, Asian, minority ethnic backgrounds, and their positions of authority in this organisation were fairly limited and certainly didn't match the numbers of patients. So there's some work to be done further, and I guess all we can do really, and importantly, I think, is to start off by highlighting those differences. We've got lots more work to do, and we've got more actions outlined ready for us to go. And I think the certification scheme has most clearly given us that framework and structure to be able to get on with this good work, and the support of Charles and Suzanne has been absolutely essential. I think their warmth and their passion and their personalities has really helped us to be able to kind of take that on. And I guess we're looking forward to carrying on the good work that we've started. Thank you.
Oh, thank you so much, Jo. Thank you. And it's been a real pleasure working with you and the staff at Caswell Clinic. It really has. So now the second certification video to the Public Health Wales People and Organisational Development Workplace area.
It gives me great pleasure to present this certificate on behalf of Diverse Cymru for the progress you've made towards cultural competence in your workplace. Thank you. I'm so honoured to receive this certificate. It's been a real great pleasure to work with Charles and Suzanne towards actually gaining this achievement. I've learned so much from you and Charles, and it's been an absolute pleasure, and I'm really looking forward to the next steps
in our journey of improvement. Thank you.
On behalf of the Board of Public Health Wales, we'd just like to say a huge thank you to Diverse Cymru for all of the work that they've done with us over the past few years to support us on our journey towards racial inclusion and cultural competence. The award means a huge amount to us and the organisation, and we'd like to say a big thank you to the team here who've helped us achieve it. But we're really clear as a board that this is just the first step on that journey, and we're really looking forward to the progress that we can continue to make over the next few years.
Yes, and yeah, we were so grateful, and the board is so excited to actually hear the news of this today. And I think we're humbled by the award, and we look forward to working with Diverse Cymru so much to take this even further forward over the years to come. So thank you.
Right, it was great being able to present Sarah, Hugh George, the Public Health Wales Deputy Chief Executive, and Kate Eden, the Vice Chair of Public Health Wales, with their certificate. Sarah has led from the front, leading to significant and real cultural competency progress in the people and organisational development workplace area. Sarah, it's over to you.
Thank you very much, Suzanne. As I said in that video, I'm delighted to have received this certificate on behalf of the People and OD department in Public Health Wales. It really has been an honour to work with both yourself and Charles, Suzanne, to undertaking the work towards this cultural competence certificate. It involved examining our practices and identifying improvements across a number of different areas. And using the tool enabled us to take a structured approach and use it as a framework and make sure that we maximised opportunities to improve and make a difference. There was a lot of work involved, but it was positive and energising work. And some of the examples of what we did include setting up a network for Black, Asian and minority ethnic staff with agreed objectives, terms of reference and an executive sponsor. And that executive sponsor is Hugh George that you just saw on the video. Consulting with the network on strategic issues to build a more inclusive organisation, looking at staff survey results by ethnicity to identify the barriers and concerns in order to address them. Charles and Suzanne delivered some training on cultural competence for all of our HR staff so that they could really understand the lived experience and some of the sort of the issues that face some of our Black, Asian and minority ethnic staff in the workplace. We set up a mentoring programme, which was really successful, and that's still ongoing, and we get more members joining that each month, so it's building. Our chief executive and directors regularly put out messages to all staff to support racial awareness and inclusion, and get that the conversations going around these issues. We've celebrated and raised awareness using events such as Black History Month to actually get the message out there and invite speakers in so that people learn more. And we've reviewed our HR policies and job descriptions to make them more inclusive, and so that staff can really feel that they are valued and it involves everyone. And the impact's being seen with a number of our Black, Asian and minority ethnic staff joining the organisation, although there is still a lot more work to do to attract more people and to help them develop their careers within the organisation. The feedback from non-white staff has also been immensely helpful in bringing about change and making Public Health Wales a better place to work. It's also fantastic to see other colleagues learning and changing their practice as a result. I'm really excited about the next part of our journey, which is embedding and working with Charles and Suzanne to take it to the next step. Thank you.
Oh, that's really great. Thank you, Sarah. And again, it's been great working with you and very well done. So now we have a pre-recorded contribution from Andrea Gray, Public Health Wales Improvement Camry Mental Health Development Lead for Wales, on the proactive partnership working between Improvement Camry Wales and Diverse Cymru.
Wales, sitting in Improvement Camry in Public Health Wales, and I was very pleased to accept the invitation to speak at this inaugural Cultural Competency Certification Scheme Award event today. The work, as you will all know, has been done by Charles, Suzanne and the team at Diverse Cymru. Their continued drive, commitment and passion to ensure our services meet the needs of people from all groups is always present. Congratulations to those that have received their awards today. I'm sure we will see many more as uptake of the scheme expands. Others will talk more eloquently than me about the detail of the scheme and how certification can make a real difference to the lives of people from Black, Asian and minority ethnic communities, but also, in my view, to the staff that work with them. However, I did just want to make a few points that I know will be familiar to many of you. We know that in order to create services that are equitable, we need to adapt and change those services for them to become truly person-centered. We know one size does not fit all, and we know the law, effective, moral, and ethical practice requires us to make reasonable adjustments. However, we know this doesn't often happen. Many of you will be aware of the health inequalities that have been highlighted during the pandemic, and specifically for Black, Asian, and minority ethnic people. This applies equally in mental health and learning disability services. To start to address those inequities, we must work together to ensure that our services are culturally competent. And I wanted to share with you some of the work that we have been doing with Diverse Cymru to raise awareness of the impact of the unconscious biases we all carry, the importance of that cultural competence, and the value of the certification scheme in making the step changes that are required in practice. To set the context for that work, we've been talking in mental health about the importance of hearing from service users about what matters to them, what are the outcomes that are important, and then engaging in the support and treatment that supports those needs for some considerable time. A few years ago, we had an opportunity to focus on this and began thinking about how we might embed what have become known as PROMs and PRAMs, so patient-reported outcome measures and patient-reported experience measures. How we can embed those into everyday practice and how they can be used to support the relationship between practitioner and service user, demonstrate and celebrate improvements in well-being, and enable people to achieve their goals and aspirations. As a result of a lot of research, piloting and testing, we developed a training program that is currently being rolled out to all mental health teams in Wales to embed those outcome tools. It will also be available for learning disability teams in 2022. When we are looking to change and improve services, we need to think about the factors that might inhibit progress, but also what might help promote effective change. There are many elements which range from efficient processes to creating compassionate cultures in the workplace. But understanding the diversity of the people we work with must be central. And as I have said, we know that is not always the case. Together with Diverse Cymru, we have created an awareness-raising training program, which includes specific reference to the importance of cultural competency and unconscious bias. It consists of 4 10-minute videos that have been designed to be watched and followed by a facilitated conversation that helps people to think about what they have learned. A comprehensive supporting information booklet has also been created. We hope that by sharing these resources with all of the mental health teams in Wales, we will encourage both awareness and the need to take action. Joining the certification scheme provides the perfect opportunity to do this, and the links are also on our website. We are now doing a further piece of work with Diverse Cymru to adapt some of the videos we have created to include and highlight the needs of people from Black, Asian, and minority ethnic communities with a learning disability, and this will be available later in the year. Please feel free to use and share the resources we have developed, and which we hope will support the uptake of the certification scheme across many more settings. Thank you.
And thank you very much, Andrea, for both your contribution today and working positively in partnership with Diverse Cymru. I'm now pleased to introduce Shane Mills, National Collaborative Commissioning Unit Quality Assurance Improvement Service Director of Quality and Mental Health and Learning Disabilities. And Shane, that's a mouthful.
I could get paid by the letter, which is always good. Thank you so much for inviting me. One, because I haven't a clue how to do a remote video. So you know, this is an important event. I'm here today because if you'd asked me to do a remote video, I wouldn't have a clue. So well done, my other two organisations, NHS, great to see. And Joe made a comment about how they spread this to other hospitals. So hopefully what I'm about to say the next couple of minutes may help that. So I've been working with Suzanne and Charles for a while, you know, been an absolute pleasure. Charles is the only man who can speak quicker than me, so it's always good to see. I'm the unit that you've probably never heard of, the National Collaborative Commissioning Unit. I'm the Director of Mental Health and Learning Disability, and we have the envious task of providing assurance of the quality of care for those people because of need or because of speciality or because we haven't got the right beds at the right time, for those cared for outside of the Welsh NHS in either private or NHS England in care homes. We have about 100 hospitals and about 300 care homes on our national frameworks. And we care for about 700, 800 individuals at any one time. We've been engaged with Diverse Cymru about how we can take the learning, the tool, the stuff that Joe said from the Caswell, and support us to ensure that care delivered to patients, no matter where they are in the United Kingdom, is based on understanding, is based on compassion, is based on individuality. It's especially important, and Charles and Joe laid out earlier, that people who are Black, Asian, minority ethnic individuals, from those from diverse and vulnerable communities, are cared for by staff that understand their backgrounds, their needs, their personal stories, and their strengths and their desires. We're going to be starting a scheme next year to use the tool as part of my team's quality assurance checks in the clinical areas. So we're really excited, Charles, Suzanne, about this. Is about making those clinical changes to staff understanding and to care for every Welsh patient, so that the staff will know them better, will understand them better, will engage with them better, and make sure their care and treatment is focused not on them as problems and mental health, but with those as people with stories to tell. So thanks for inviting me here today, Suzanne. It's been an absolute pleasure listening to the benefits so far. I know we're beginning our journey together, but I know that at the end of it, we'll end up improving care to patients cared for in hospitals. Thank you.
Oh, thank you so much, Shane. We really do look forward, and we're excited as well to working with you and your team in the coming months and indeed in the coming years. Right, we were hoping as a final contribution to have the Minister for the Economy, Vaughan Gething, who launched both the Cultural Competence Certificate and the certification scheme, to say a few words. But unfortunately, diary commitments meant that he was not.
No, I'm now here.
You're here?
Yes.
Oh!
It's definitely me, Suzanne. It's not someone else. I consider sending my brother, but he's unavailable.
There you are. Oh, good to see you, Vaughan. Thank you. Thank you for being able to.
How wonderful.
Yes, wonderful. I was going to say a big, glorious thing about you being so yourself.
Oh, I should have let you say all the nice stuff about it, shouldn't I?
Oh, wonderful. Thank you.
Over to you, Vaughan.
Well, I really am pleased to be here, and you know, I've been fortunate and challenged, of course, in my time in public life. The challenges of ministerial office at any time come with real compromises on your time, what you can do outside of work, time with family, but also it gives you an opportunity to do things. And, you know, I always knew that being the health minister was a big challenge. And then the last 18 months, 2 years have been an extraordinary challenge that we'd often thought might happen. There might be a global pandemic of some kind. It was in the risk register, but then to have to live through, to see it to be not just a global pandemic, but actually a once in a century event has been something else as well. And yet now there's a new challenge in terms of rebuilding the economy after the pandemic is finally over. And I actually think that rather than reducing the importance of diversity and cultural awareness, I think it's highlighted those things as well, because you think about the harm that COVID has caused, think of the challenges we now face. We know that actually the less well off you are, the more likely you are to have poor health. We knew that a long time ago. We also know that Black and Asian origin communities are more likely to be concentrated in those communities and families. We know that multi-generational living has been a real challenge and a real factor in COVID harm as well. We know that Black and Asian origin families are more likely to live in multi-generational households as well. the harm that COVID has caused hasn't been evenly spread across our country and our society. And yet, so they're the challenge on how people access services that understand who they are and understand the particular challenges, and to make sure that we know that this isn't just a physical health issue, this is very much about the general mental health and well-being harm that's been caused and what that means for the future. Now, I think that provides an opportunity as well to look again at what we have done and we can be proud of having done, not just in this last couple of years, but actually in a broader period of time in making some progress. And, you know, the statute of Betty Campbell is part of that, some recognition that we exist, recognition that women exist and have significant achievements, recognition that Black people exist and have significant achievements as well. And Betty was a real person, you know, she wasn't a comic book hero who is perfect in every way. She was a real person with feelings and thoughts. And, you know, she mattered when lots of Black people didn't matter. The challenge now is how do we make sure that Betty's experience living her life isn't the one that people live today? How do we make sure that whether it's a business or it's a public service, that people say this person in front of me matters and I need to understand more about them to deliver the sort of service, the care that I would want for me and my family. And actually, having launched the first cultural competence framework with Diverse Cymru and with Suzanne, I'm really pleased to see the continuation of this and the partnership with the Royal College as well, to recognise that diversity isn't just something for lefty liberals or to be dismissed as being woke. It actually matters for all of us. And in my new role, I had a really interesting conversation with one of the Welsh envoys in the United States. He's running a tech company in California, and his mum and dad live in Bridgend, County Borough. And he said they were delighted to get their vaccine and to get it on time. They were very positive about the government. Actually, he was making a point that in America, diversity really matters. He was saying in the tech business in California, this isn't just about doing it because it's a nice thing to have on your CV. It really matters about who you get, about the talent you have, about the talent you will miss, and needing to understand the communities where you can draw that talent from, as well as the communities who will be your customers. And so this is a very real thing. And he was making the point that actually having a headline minister who looks like me is a real positive and a strength in our relationship. But I was really struck by the way that he took it as a given that this would matter, and it should matter. And you know, if you think it matters, then how do you understand how to do it properly? How to make sure you're not making mistakes you don't have to, and how to learn from those things as well. And I think one of the things about the competence framework is it's not about judging people, not saying because you didn't know this, you are a bad person. It is about how do you improve? How do you get to grow what you can do in a way that is genuinely positive? And I think that gives us real strength, because we still live in a time of challenge, but we also still live in a time of real opportunity. And that's what I want to focus on. How do we get to do things better for each and every one of us? Because we may have different histories, but we absolutely have a shared future and a shared interest in all making progress together. So I'm really pleased to be able to be here in person to say a few words. I hope Suzanne's going to say really nice things about me now I'm finished as well. But you know, I look forward to seeing the outcome of this and to seeing how many people have gone through the not just getting certificates, but then seeing what has changed about the way people undertake their practice, and to be able to say, are we now in a better position? And I'm really confident that people will be able to tell that story. So thank you very much for some time this morning. Really pleased to be here on a screen. I look forward to seeing you in person when we finally exit the times we're living through and get back to what the new normal is and our opportunity to shape what the new normal really should be. Many thanks. Good to see you, Suzanne. Good to see you, Charles.
Good to see you, Vaughan. Thank you so much. What a lovely, lovely surprise to see you. And you stole my line saying about shared histories and future, because I always say that. We don't just have Black history, we have Black history, present and future. So thank you so much, and for your support, the commitment you've always provided from the start of our journey. We're so grateful, and we're really pleased to see you this morning. Thank you, Vaughan. So now we're moving into our Q&A session, and if you had any questions, to put them in the chat. I don't see any at the moment. Charles, was there something?
Not a question as such, because in a sense, I think it's been fairly comprehensive in terms of it. There is now an opportunity, just really in terms of maybe things that you may want to know that's not been perhaps explained properly, or even, I think as mentioned before, how do I join? So it's things like that, yeah, in terms of to take the opportunity whilst you've got a panel from very many different areas to be able to ask any questions that you may have on your mind.
And for them to go in the chat, isn't it? Because they're not going to be able to speak over.
I don't know, Charles, if you wanted to say anything about the actual length of time that it takes in terms of, I mean, obviously we've got two recipients here with us this morning, but you know, we talked about that the scheme is flexible for all types and shapes of organisations. So it might be useful if you would say something about the kind of how long does it take.
Okay, well, it's actually interesting because the issue about the scheme being unique, it really depends. And there's not like a set framework that you join now and in a year you have to do this and so forth. We work with you. And the important part of that is the ownership that you actually have to have a view as to when you feel ready to attain a particular level. And there are 4 attainment levels in terms of the scheme. And if I can put it this way to you, by way of an understanding, the foundation level, in simple terms, means that you're doing very little. The level of developing means you're doing a bit. The third, in terms of competence, means you're doing quite a lot. And as Sarah mentioned before, the 4th is the embedding. And that's where, in terms of the workplace developmental tool, we would want everyone to get to. But it's that journey that they will have in continual progress, which is the important part of this, in terms of saying, I've done this, I've ticked the box, and I can do that. It's the ongoing need to look at your practice and to take that practice forward in terms of being able to ensure, as many have said, that you're meeting the needs of all in an equitable and inclusive way. So the simple part in terms of duration of it, is that we'll work with you and we can have a discussion and a conversation in terms of the level you're at and whether you want to stop there or go on. So it's flexible in terms of the duration.
Okay, there's 2 more. I'm just looking in the chat now. I've got 2 more things. There's one from Tony Hendrickson asking what has surprised us, both positive and negative, since rolling out the programme.
Okay. Positive has been, for me, the enthusiasm there's been in many of the participants that we've gone to. And the positive as well is that in terms of some of those participants, where there might have been a worry in North Wales and West Wales and so forth, have embraced what we're doing. And even in terms of something as simple as, I'll just use this as an example, as the Royal Glamorgan Hospital, where we did the admin and reception area in terms of as a participant, undertaking an Eid celebration. Never done anything like that before in terms of basis of that. But actually doing that and actually seeing how great it was, wasn't only for staff, but the doctors as well and so forth, something really positive, that they could actually say. And it's actually made, in terms of keeping the issue of culture on the agenda, real for them, in terms of seeing and seeking to understand, different people. So to me, that's the positive, a real positive in terms of people getting understanding and being able to sort of deal with that. Negatives, in the same way, and there are pockets, I'll put it that way to you, where you'd go somewhere and they say, well, and I don't say this in a bad way, but well, we don't have any black people here, so no need to do anything. And whilst you can deal with that as part of the awareness sessions we actually provide and so forth, it is a negative in terms of that, not a surprise that you still have views of that nature, despite pointing out to them. And again, one of the things, particularly about demography, and in that particular place that I made reference to, they had the 5th highest number of ethnic minorities in Wales. So part of being able to provide some understanding for them, in terms of what they may see as is something that I think there's some work still to do with regard to that, And I think there's a question there in terms of what I regard as intersectionality. Another real big positive for me, and this is what's come about, is this. Although the idea of sitting down and talking to people and using race as a vehicle to understanding, a big question that we often ask is simply this: how do we treat and interact with people who we perceive as different to ourselves? And that's not only about color, it's about how we perceive one another. And what's happened in terms of that, a number of places have actually come back to us to say, not only are they doing things with regard to providing the cultural competence needs of Black people, but it's also given them food for thought in terms of what they're doing for LGBT, disabled people and so forth. And it's about opening people's minds, in terms of that understanding, which has been, I think, is one of the big things and the good things about this, is sitting down and talking to people. And by way of sitting down and talking to people, the awareness sessions are limited to small numbers, because it's not about lecturing, it's about sitting down, talking to people, getting their views and so forth, and starting that conversation, which we insist should continue in the organization in terms of that understanding. So that again is a sort of, I'd say to you, in terms of related to intersectionality, an important aspect of all of this, because once your mindset, deals with the issues of lack of cultural competence, and if you ask me what's culture, and it can refer to so many different aspects of that, but also the issue of our own unconscious bias, and that has been a big plus in terms of people being able to understand, not me saying that there isn't conscious bias as well, because there is, but it is that basis of that understanding and starting that discussion, which I hope in terms of participants will continue in terms of our help and support.
Thank you, and I'd just like to echo what Charles has said, because the enthusiasm is tremendous. And I would say the enthusiasm, the positive, and the progress made. And look, we just got 2 certificate holders here today because of the progress they made. And I'd just say, for the negative, I would say, being told to our face, you're playing the race card again. So that was the negative, but they were brave enough to say it. I think they maybe too daft to understand the consequences, but they said it, and it's not the first time that's been said to us. So for me, that was the negative thing. It was negative, in other ways positive, because we know what's in people's minds, and we try to change their minds,
address it,
have a different point of view, isn't it? Yes. Just to say, somebody in the chat, Ruth Joyce, said, as a new future participant, should be keen to be linked in with those who have completed the scheme. We are a very small team providing mental health assessments in criminal justice settings, as well as triage assistance in police control room. So that's from Ruth Joyce.
Ruth Joyce, yes, who's just registered. and we'll be starting work with them week after next, Ruth. So good to know.
Right, somebody else now, if I can just say another one, because I know we're running out of time. Junaid, good morning, Junaid. Said not asking the question from a professional point of view, rather asking if from a member of the BAME community, how will we measure change and how will we, in brackets, people from BAME communities notice a difference?
Okay. Two things I would say to you, and I don't mean to sound in terms of a basis of at all negative about this. One of the things we often say to people is this, and this is the service providers in the main. What we're not looking for is for you to change the world overnight. What we are looking for is incremental, ongoing progress in terms of what you're doing. And so in answer to Junaid, I can't say to you all of a sudden that you'll see a change, but what you should see, and Junaid, are you from Public Health Wales? Is that the same Junaid? Yes. Yeah. One would hope within the organisation that in terms of being able to see a difference of approach, and I think Sarah mentioned the forum that had been set up. And again, in discussions last week, some very positive views in things that they wanted to do. So all I can say to you is that in terms of any ideas or views that you have of change, because we're limiting this to workplace areas, only happy to take those on. And as part of our assessment in terms of, and our encouragement, what we would be doing is taking those back to the service providers, in this case, the people and organisation development team, as to what they're going to do about this. So there is another, in a sense, another advocate for you in terms of being able to look at issues that you may have.
Yeah, because it's going to be about the people's outcomes and the organisation's monitoring and review of their services and the type of feedback that they receive from people who use their services as well.
Charles, I was just going to add to what you just said there. In terms of one of the things you expect this scheme to have an impact on is kind of the priority that organisations give to issues around issues of that affect BAME, that are involved in terms of investment in culture. As we know, the pandemic is putting stress on organisations in terms of their resources, and this area, investment in equality, diversity, and inclusion, and cultural competency, those areas can come under stress in terms of cuts first. So what you expect is that these kinds of schemes will enable those champions within the organisation to make the case for cuts not being made, and giving them real tools and metrics to be able to defend their space when organisations are under pressure and they're looking for cuts, because the evidence shows that, you know, across the public sector in particular, that that it is having an impact on the investment in this area. So I just make that point, Charles.
Yeah, thank you for that. And it's an important point. And part of the investment part of it, as you know, Junaid, I think Public Health Wales have just gone out to get an equality advisor. And I think a basis of that it is seen as an investment in trying to actually to be advising the board of Public Health Wales, if I'm right, Sarah, in terms of that. So I think you could see that by way of what Anthony was just saying, of not putting it to the back, but actually sort of wanting to do something forward. And dare I say that the basis of the work that Sarah's been doing, and if you like, keeping the issue of equality, diversity, and cultural competence on the agenda, that appointment may not have happened if we hadn't been doing this.
Okay, if I can read something as well from Hughie Webb, she says, excellent tool presents an opportunity for organisations to deliver real change. I'd be interested in meeting with Diverse Cymru to discuss working with apprenticeships providers. Increasing diversity of health and social care practitioners is a particular focus. How often do you regulate progress with certificate holders?
That's good to, and I think the opportunity that Welsh Government, I hope, will provide in terms of expanding the scheme from, as we started with just mental health, and what's been, and again, it's not answering the issue about apprenticeships specifically, but the number of local authorities just recently who have made contact is an encouraging sign, I think, in terms of the basis, in terms of the whole, in terms of the public sector, and that area in particular, in terms of maybe coming on board and having a basis of giving priority in terms of what Anthony just said to this as an issue, because in truth, it hasn't been there in the past.
Okay, Samina Khan says, look forward to exploring more for Carden Vale College when we meet. Chris has answered Ruth's question earlier on, saying, I'm sure we can connect you up with those who have completed the process. Shared learning is so important. Rafat Arshad asks, would services say we don't have any disabled or LGBTQ plus people here? That hasn't been said to us.
No, I did make reference to the issues about intersectionality in response to that.
Saying would services say that they don't have those groups there? Emma O'Donovan from Kaleidoscope says, just to echo Ruth's comment, Kaleidoscope project is committed to the accreditation, but it would be really useful to discuss learning from those who have been through it already. And Ruth says maybe they can buddy up.
Yeah.
Share the contact details. Thanks, Charles. Junaid says, thanks, Charles. Makes sense picking up on points earlier. Talented people. Sujata would like to chat with us to find out how to promote this in healthcare sector as well in the corporate factors. And thank you for the lovely session. I'm just looking for some questions. I know we're finishing now. Right, and Andrew Gray says the real opportunity presented by the engagement with all of our communities in relation to vaccination needs to be embraced. I would like to see the toolkit as helpful in focusing some key actions.
Very much hope that that will be the case. Yep. Do you want to wrap up?
Yes, okay then. So in closing the event, I first just want to thank all of you for attending, especially the speakers and the scheme participants who received their certificates today. Again, if there's anyone at the webinar who would like to find out more, please contact us. And second, in recognition of Black History Camry 365, the theme here in Wales is of celebrating local heroes and sheroes. And in the UK Black History Month, the theme is of proud to be. I would like to pay tribute to the Welsh Government for the positive steps that they have made in promoting cultural competence, as demonstrated, for example, by the recent unveiling of the statue of Betty Campbell, a real shero, and the recent announcement that Black history lessons are to be made mandatory in Welsh schools. And also in recognition of the World Mental Health Day theme of addressing the issue of mental health in an unequal world. That's like a tongue twister, isn't it? I would like to think, as indicated by Charles, that the certification scheme funded and supported by the Welsh Government is a very positive step in the right direction in addressing the issues of this unequal world that we live in, with the potential to make a real and lasting difference in the lives of the Black, Asian, and minority ethnic communities in Wales. And to that end, I would like to say hwyl fawr and goodbye to everyone. Enjoy your day and have a fantastic weekend. Thank you and goodbye.
And thank you, Suze, for your facilitation.